Welcome, I'm Dr. Carol Berger.
Hi, I'm Dr. Nina Zimmerman.
And we are Nurse Practitioners Changing Practice. And we are so happy to have Margaret Benz with us tonight. She is a distinguished assistant professor at the St. Louis University and our state representative for the American Association for Nurse Practitioners in Missouri. So welcome, welcome, welcome. So glad.
Thank you, Margaret, for being here.
Well, thanks for inviting me.
So tell us a little bit about yourself and what's going on in the legislative world.
Okay, so we've been busy in the legislative world already. We started actually way back in November getting our bills together and our talking points together because we had a change direction since our bills changed again this year. I represent AANP, and there is a couple representatives from MONA, a couple representatives for the Association of Missouri Nurse Practitioners, and then there's some representation from the Board of Nursing and representation from NCSBN. And we all work together to choose what bills that we want to move forward and what our talking points are, because we're trying to unite all the nurse practitioners across the state as one voice. Because we do have nurse practitioners in every single county, even though they can't work in their counties because of our restrictions. But we find that if we work together, we all have the same message, we all carry the same talking points, that we do a lot better when we act as one voice. So,
and this last week, there was a lot going on, wasn't there?
Yes, last week there was some interesting bills from Jeannie Riddle, and Jeannie's a senator from actually the Jefferson City area. And she put forward a bill that's Senate Bill 8. And Senate Bill 8 had in it a definition of surgery, but it also had something that they call truth in advertising, that they felt like nurse practitioners that use the title doctor was misleading to people. And so they put forward this bill that would block anybody other than a physician or surgeon from using the title doctor. And our argument is that doctoral degrees are hard-earned degrees by 84 different professions across the state. There's that many different people who can earn doctorates. It can be a veterinarian, it can be a physical therapist, it can be a nurse, it can be anybody. And to limit anybody from using a title that they've earned that's an academic degree is just not fair.
So what you're saying is like a counselor that is known as Dr. whoever, right, could not say they're a doctor anymore.
Yes, they were trying
or
to.
A veterinarian couldn't be a doctor anymore. So it's not just the nursing field they were going after. They're going after everybody. Doctor. A person in education could not say doctor.
Right. So if you use the title doctor, they wanted you to define what your school was, what your degree was, and who titled you as a doctor, which seems just silly to me because they're medical doctors and they're doctors of osteopath, but they're also physicians and surgeons, just like we are doctors of nursing practice, but you go by nurse practitioner.
Right.
So we think that if they want to use a title that makes them unique and stand out separate so that there's no confusion about who's who, they should use the title physician and surgeon and leave doctor to the people who've earned those degrees and should rightfully be able to use them. So that was a big discussion last week.
How did that end up?
Well, we think it ended up pretty good. In committee, it was hard to tell. There was a lot of different people that testified against that bill, nursing being one of them, but dentists were there, veterinarians were there, all kinds of people were there. In supporting that bill were only physicians. And mainly one of the people was an anesthesiologist from the Springfield area that had a real issue with a nurse anesthetist calling herself a nurse anesthesiologist and opening a ketamine clinic. And that is a trend that nurse anesthetists across the country are trying to change their recognition to be nurse anesthesiologists, but it still carries that title nurse. But they have a problem with anyone using any ologist too. So they also in that bill is no one can use cardiologist, orthopedist, orthopod, gastroenterologist, any of the ologies. They wanted to get rid of all of that. And that's not unique to our state.
That would be expensive because all of these people who have these titles have printed that on their business and their, you know, I mean,
windows, advertisements.
Yeah, I mean, their cards, everything, that if they're like a gastroenterologist, they would have to change it to what?
Yeah.
To gastro? What did they change it to?
Okay,
well, the physicians are allowed to use those titles.
Oh, just the physicians are allowed, but nobody else can use pathologist.
Right, right, because they said that that's their titles and nobody else should be able to use it. So we think that if they have a problem with who they are, they should put it in their statute, because ours is clearly labeled in our statute that when you are certified by the American Academy of Nurse Practitioners, you put a C behind your name. If you're by the AACN, you put a BC behind your name. And it tells us very specifically what order our credentials have to go in. So it's really redundant legislation. It's in our statutes already, and it's in other profession statutes. So we think physicians should just clean up their own problem and not drag us into it. But it was a big issue because this is the second year that this has come back. We don't think they have the votes. And Jeannie Riddle, it's her committee, it's her bill. And so they usually don't call for the vote the same week, but the following week, but she can always choose not to call for the vote if she thinks that her bill will lose. And she can also put a substitute in and then try again with a different substitute. Actually, what the committee heard was a substitute because there were so many calls and so many letters and emails and things that it junked up all the legislators on the committee's mail and email and telephone lines. And so they actually put off hearing it for a week. And then they did hear it, but they did take the surgery definition out that would limit anybody other than a surgeon from doing anything that was an incision or a repair or a destruction, which is how you bill and code biopsies when you do, or a cryo surgery, yeah, or incision and drainage.
Incision and drainage,
suturing. All those office procedures that we're all trained in and we all do in our practices, and it saves patients money. And sometimes you get a result from a biopsy back that helps know that they need to escalate how they see that patient as opposed to waiting 4 to 6 months. But also for rural people, they don't have that many people to refer to.
How far would they have to go if they cut themselves, if they normally could go to their clinic in town to find a physician? And what about urgent cares that have nurse practitioners there? That's a big part of what they do.
All of those
that would really impact patient care. That would just be so horrible.
It would. You know, you said how far would they have to go? There are some parts of Missouri that, because we've lost 6 hospitals across the southern part of our state, there are some parts of Missouri where you have to go like 100 to 150 miles before you hit healthcare.
Oh my gosh.
Because nurse practitioners have to be within 75 miles of their collaborating physician. Big gaps. Yeah. So yeah, it would be a big impact. So right now that bill should come up for a vote, but it has not yet. And they can either vote.
You're thinking it won't pass.
Right now, we don't think she's got the votes for it, but if there's a substitute that goes in, like they did take out the surgery definition, but there is a separate bill for that piece too. So I don't think she had any problems taking that out because she knows she's got another bill with that in it. But we don't think she has the votes for the doctorate part either. So we'll see, but she can always, if she doesn't take a vote, she can always try to add it on to something else that's moving. So that's something to keep an eye on.
So what about the changes this year because of COVID? We've had things that we've gotten loosened up, but I understand that those won't be forever.
Well, right now they're not forever. Right now they're loosened. What we've loosened up is that the 75 miles, you can be any distance right now from your collaborating physician. And also the 2-week rule where physicians had to come in and sign 10% of your charts and do that every 2 weeks. And then the month working with the collaborating physician. Now, I know the physicians don't really have any issues with that, not working with them for 1 month before you sign a collaborative practice agreement, but they really want that mileage restriction to go back on, and they really want that chart review to go back on. They don't think we're capable of seeing patients independently and making good decisions. And so
let me ask, do they get paid a percentage for chart review?
You know, there's a lot of people, like there's some nurse practitioners that own their clinics and they have to pay the physicians to come in to do that. And so it's actually very lucrative for the physicians.
Yeah, I was going to say, even though I wasn't in private practice, I think that my physician, the organization paid them so much per chart that they reviewed. So that could be just a monetary thing they don't want to give up.
Yes, it is very lucrative for some of them. Actually, if you talk to people like in the southern part of the state where they have to pay their collaborating physicians a lot, it's outrageous. I mean, when legislators hear those guys talk about how much they have to pay, they're like astounded because it's really expensive. So yeah, that is a problem. And we do have two bills. We have House Bill 8 and Senate Bill 293 that are barrier relief bills, and they would strip those barriers permanently because they're set to go back in the end of March. But they would strip those permanently, plus all the other crazy things we have, like that we're supposed to hang a sign saying we're nurse practitioners and they can see a physician,
right?
You know, and just all we have more regulation than anybody else, but
well, you were
we have to refer everybody
too, and you were talking about diabetic shoes. I mean, we have restrictions on being able to see these type of patients that would help to remove some of those restrictions, right?
Right. So home health is totally different though, because home health was part of the CARES Act. It was first, like in 2018, it was an executive order by Trump that they should make sure to give nurse practitioners the ability to do that. And then they had a certain time frame to activate that. When the CARES Act came up, they put it in the CARES Act and it actually became active sooner than it would have had to be active. So in the CARES Act, it becomes a permanent change for CMS, but CMS can only direct Medicare patients. So to make that active in the state so that nurse practitioners can order home health for their patients and all the support services and recertify it when it's time to recertify. For it to be active in Missouri for Medicaid patients, we have to pass legislation this time. And that has a hearing coming up on Wednesday of this week. So it's Senate Bill 177 by Senator Brown from Phelps County is doing that bill.
So if that passes, that would mean that nurse practitioners could certify for home health, whether it's Medicare or Medicaid, and that really opens the door, right? And recertify if they need that. So yes, that would be a big help.
Yes, because usually once CMS does something, all the insurance companies follow.
We'll go with it. Yeah. So now how do we, I understand physicians and doctors of osteopathy have strong organizations. And I love how you said we want to unite the nurses, nurse practitioners across the state of Missouri to be one voice. How do we do that?
So right now, we have many organizations at many levels. So locally here in St. Louis, we have a really strong St. Louis Nurses in Advanced Practice organization, and they are very active with AMNP and AANP because they're an organizational member of both of those. And so they get communication passed down from them, but also there's the nurses of the Ozarks and there's the nurses of Kansas City, nurse practitioners, and they have very strong organizations too. And then the next layer up from that is the Association of Missouri Nurse Practitioners, and it's just nurse practitioners across the state, and they communicate information down to those smaller ones around the state. There's also Missouri Nurses Association, but they represent all nurses across the state, not just nurse practitioners. It's LPNs, it's RNs. So they have not just the advanced practice legislation that they fight for, they also have things like workplace violence is their big thing right now that they're pushing for. So they have all kinds of other stuff too, but the all those nursing organizations, Missouri Nurses Association, AMNP, and AANP, which is me. And then there's the Board of Nursing and there's NCSBN, the National Council of State Boards of Nursing. We all meet, there's representatives from each of those. We meet, we decide what legislation we're gonna push forward. We decide on the talking points, and then we filter that down to all the other organizations. So when we need something, a call goes out and it filters out to everybody, and then letters, we need people to make calls, send letters, talk to your legislators if you know them. Get to know your legislators when they're in district, because nobody's getting in the Capitol these days. They're kind of keeping it locked down, and no one wears a mask there. But so it's good to join an organization, because then you know what's going, and things this time of year happen fast. And so it's good to be in an organization where they give you like, here's a notification. We need you to send it on this day. Here's talking points.
Right. And I notice when I get your notifications, it tells me what to do, how to do it.
Exactly. It's wonderful.
It's right there. And I can put out, send a mail or write up something and send it off as testimony. And then you have, and it does make a difference. I think we think sometimes that our voices don't matter, but they do. It does. Mm-hmm. And I think you can really testify that it really does make a difference.
We delayed that one bill, and we thought we were going up against a big battle on this last one. But the votes the votes that are there that we know of are not supportive. It's more supportive of us. And so we do make a difference. And people are really listening to nurses right now. We have a big group. We've really gotten to know our legislators. So we usually know our own legislators very well, but we also know other people in the Capitol. And so it's very helpful to write the letters and things. And especially when it's more personal, when it's not just a form letter, when it actually says, I'm your constituent, and here's what's going on with the people in your area, and here's how I make a difference.
This impacts. Yeah, you know, this impacts the care of my patients. We're used to advocating for our patients in the hospital, but as nurse practitioners, we need to begin to start advocating for our patients through legislation that can make their access to care easier, so that they can see a variety of different types of clinicians in their area. I'm going to share your screen now. Let me see. And there it is.
This is important information for everybody to have.
All right. Do you see that?
Yes. It looks great.
All right. So explain that to us, Margaret, and how we can get involved.
Okay. This is from AANP, and AANP is the overarching organization. There are 300,000 nurse practitioners almost in the country. And AANP has about 120,000 of those people as members. So we have a very strong voice in DC. We are always called to be at the table, and we are always called to support and testify on things in DC, and not just there, but in our state. And they're very supportive of our state. They look over our bills, they give us tips, they give us direction. And so this is the National Organization for Nurse Practitioners. Our mission is practice, education, advocacy, research, and leadership, which is we call PEARL. But in practice, we have guidelines and standards. We do a lot of research and get you a lot of information. In education, we have a lot of free continuing education, including like the buprenorphine waivers are all free on there. But there's a lot of education. All their conferences were open for a long time this year to give a lot of education that way. They're a certifying body. There's the advocacy piece. They do both state and federal and update. Right now, they're updating very regularly, but they're also fighting for us very regularly. And we have a really strong lobbying force in Washington. And then research, they do a lot of research that you can participate in, but you can also ask them to research something, and they'll get you data from across the country really fast on that. So, and then they have leadership and mentoring. Yeah. So they have a lot of really good resources. There's a QR code on here that you can scan in, and it'll bring you to join it. And if you use that membership discount code MO18REP, that's my code, and it gets you a 10% discount. And if you're a student, you join at half price, and then you get a discount when you take your boards, and you get a discount for all, like, everybody gets a discount for all the continuing ed and things like that, and conferences that they do.
That's tremendous.
Yeah, and there's 2 journals included too.
Yes,
yes. Right, yeah, there's the Journal of Nurse Practitioners, so then you get that.
I'm a member, and we're all members, and it's tremendous organization, tremendous support. Yeah. So I would encourage.
I like what you said. Yeah, we need to become one voice, and we need to become strong, and we need to advocate for our patients and understand that part of that advocacy is fighting legislation that is going to be detrimental to our profession, such as not being able to use the title doctor if we've earned our doctorate, or not being able to provide services that are very needed across our state. Yeah. Margaret, I thank you so much for your
Margaret.
knowledge. We can't thank you enough, and I have a feeling we'll be asking you to come back because there's so much to talk about that our new NPs need to know. So I think that's it from this time to next. We will see you next week, but stay tuned for more interesting subjects.